probably have noticed, I am sitting on my floor today, and as it should be, because this week is trying to kill me. I almost came on here in my bonnet, and I was like, let me not be that ratchet person, even though I wear my bonnet outside all the time. So today I kind of wanted to do an informational video. In case you guys didn't know, it is National Women's Health Week, May 10th through May 16th, and there's already a lot of great informational videos out there. But today I kind of wanted to do something a little bit different and something that's not really talked about, which is birth defects. Because it's also National Alcohol and Other Drug-Related Birth Defects Week, May 10th to May 16th. So this video is probably going to go up on May 16th. I mean, like I said, this week is trying to kill me. But I did want to get some information out there because I feel like I have patients who come in the clinic all the time scared to death because they had a sip of wine before they knew they were pregnant, or they want to take a sip of wine whenever they are pregnant, or they want to know if one drink is going to harm them, as well as if tobacco severely affects the baby, marijuana affects the baby, and if other medications that they're taking will affect the baby. So I felt like this is the perfect time to address those questions. So we're going to start with the number one question, which is alcohol. So first and foremost, what is a birth defect? A birth defect is a physical or anatomical abnormality that presents at birth. So you could have something like cleft palate, ventriculoseptal defect, which is considered a hole in the heart. You may have 6 fingers instead of 5. Those things are considered birth defects. So birth defects can either be caused by genetics, they can be caused by infections even, or they can be caused by drugs. If the physical abnormality is caused by a drug, then it's known as a teratogen. So if you hear me use that term throughout this video, then that's what I mean. It's a drug that causes those birth defects or birth problems. Yeah. So if you guys have been talking to anybody on the planet, somebody has probably told you that it's okay to consume alcohol in pregnancy. I get a lot of patients who are like, oh, well, I was told that it's okay for me to consume about 4 to 5 ounces of wine, of red wine a day. ACOG, which is the American College of Obstetricians and Gynecologists, that's kind of like the overhead group that kind of makes recommendations to practice guidelines for OBGYNs. So we follow their recommendations, and they actually recommend no alcohol in pregnancy.
Oh no!
Sorry, y'all. So this rumor that's going around where you can have 1 glass that contains about 4 to 5 ounces of red wine a day with dinner in pregnancy is just not true. Now, I will say, whenever you are, trying to conceive, or if you do end up having an unplanned pregnancy, 1 sip of alcohol or 1 glass of alcohol, or maybe if you just went out with your girlfriends for a night and you had a few drinks, that's okay. Number 1, alcohol affects the frontal lobe of your brain, which is right here, and that affects your judgment zone, right? So who's to say if 1 glass of 4 to 5 ounces, which contains about 15 cc's or milliliters of ethanol, which is alcohol, who's to say that that small amount of alcohol can't impair your judgment and prevent you from saying something like, oh, well, I'll just have a 2nd glass and I'll just have a 3rd glass. So that's number 1, is it impairs your judgment. Number 2 is it also impairs your memory. So who's to say that that small amount of alcohol may not make you forget that you already had 1 or 2 glasses. So that's the number 1 reason why I don't recommend alcohol in pregnancy, even if 1 sip of wine is okay early on in the pregnancy, as I said before. It's just not something that you want to do, and the recommendation is actually that you discontinue consuming alcohol the second you find out that you're pregnant. So that is the recommendation. Sorry for all you ladies out there. I do get texts quite often from my pregnant patients saying, I'm at dinner, can I have a sip of wine? And I'm like, nah, girl. So fetal alcohol syndrome, which is an overall condition that's caused by heavy drinking in pregnancy, which causes abnormal facies, slow cognitive function, which is just slow brain impairment in children, as well as mental retardation, is usually associated with heavy drinking, which is more than 3 drinks that contain about 15 cc's of alcohol per drink. So I'll kind of leave like a pictogram somewhere in this video that kind of tells you what is considered as one drink. One drink for us physicians is anything that contains more than 15 cc's of alcohol. So even though fetal alcohol syndrome is associated with heavy drinking, it's also associated with moderate drinking. And guess what's considered moderate drinking? 1 drink per day. And 1 drink per day in regards to wine is considered 4 to 5 ounces of wine. So even if you're having 1 drink per day, it could still possibly lead to fetal alcohol syndrome, and that is why we don't recommend alcohol in pregnancy. So another question that I often get is from postpartum mommies who are breastfeeding who want to consume alcohol, and the recommendation is if you are breastfeeding, you can certainly have alcohol, but you want to wait 3 to 4 hours after consuming the drink to breastfeed your baby, because if you do, you can have slow psychomotor function of the baby can become very drowsy. So just pump and dump for 3 to 4 hours after you consume alcohol before breastfeeding your baby. So the second substance that we're going to talk about is tobacco. I do have some mommies that do smoke tobacco-related products, whether that's cigarettes, cigars, pipes, dip and snuff, which is whenever you just kind of chew the tobacco pieces, like kind of in the side of your mouth. Whatever the case may be, we do not recommend tobacco at all in pregnancy. Obviously, tobacco outside of pregnancy causes adverse effects on your health, so definitely in pregnancy, we want you to avoid it. So, you know, in terms of mom's health, it can cause mom to have decreased thyroid function, which is very important to supporting the pregnancy. It can also cause preterm labor, preterm rupture of membranes, which means that you can break your bag of water early, and increased risk of ectopic pregnancy, which is a pregnancy located outside of the uterus. In the baby, it can cause intrauterine growth restriction or intrauterine growth retardation, which means that the baby isn't growing as much inside, and that puts the baby at increased risk for low birth weight, perinatal and postnatal mortality, and placental abnormalities in the pregnancy. And children who are born to mommies who do smoke have an increased risk of having asthma, infantile colic, which means less sleep for you after that baby comes out. They're gonna be up all night crying because their tummy hurts, as well as childhood obesity. So, you know, these are the main reasons why we don't recommend tobacco in pregnancy. But like I said, there's many more reasons as to why we don't recommend tobacco products in general, just because of the adverse effects it can have on your health. Number 3, y'all, marijuana. I think because a lot of the younger generation hasn't been told or hasn't heard that marijuana is associated with several health effects like tobacco has, then they assume it isn't as noxious or it isn't as dangerous to your health as tobacco is. And I am here to tell you, stop that. Anytime you are inhaling a noxious substance inside of the lungs, it is dangerous to your health. So that includes marijuana. So I kind of want to address the reason why people haven't heard that marijuana causes as severe health effects as tobacco. Obviously, both of these things come from the earth, right? So they've been around for centuries, and tobacco has actually been smoked since 5000 BC. And the adverse health defects started being studied around like the late 1800s, mid 1800s to late 1800s, and the adverse health effects were finally reported, I think, in Germany in the 1940s. So it took about 100 years of studying for us to find adverse health effects associated with tobacco. Marijuana is a little bit more novel than tobacco, so people started smoking it, according to my research, around the 1800s. I'm sure that, you know, it probably dates back a little bit before then, but this is just kind of like a guesstimation. So we haven't really started studying the adverse effects of marijuana on our health until very recently. So it's going to take some time to expose the adverse health effects that marijuana does cause. But for now, we do know that marijuana does cause an increased risk of stillbirth, which is whenever the baby passes away inside of the uterus or postnatally. And it also causes attention and behavioral problems in children. So even though marijuana may be legal where you are, it still has psychogenic and adverse effects on your health for you and your baby. So we do not recommend marijuana smoking or edibles, whatever it is y'all got out here. I'm sorry, I'm not abreast on all of the things that this younger generation has going on. But definitely smoking marijuana, consuming edibles, those are not things that we recommend in pregnancy. Definitely not outside of pregnancy as well, unless you've spoken to your physician about increasing your appetite if you have cancer or things like that. But specifically in pregnancy, we don't recommend marijuana consumption, even if it's legal where you are. So I handled that.
You were cold as ice.
If you are smoking, whether it be tobacco-related products or marijuana, you should always be able to talk to your physician openly. We are not here to judge. I get it. Some of the people that I know are the smartest people that I know, and they smoke cigarettes or they smoke marijuana. This is a judgment-free zone. There's no one here to judge. We're just here to help you because we have two patients. We got the mama and we got the baby that we got to worry about, and we just want a healthy mom and a healthy baby at the end of all of this. If you are smoking, talk to us. We can give you tools to behavioral health or referrals to any of those types of services to kind of help you with cessation in smoking. So now we're going to talk about some medications that a lot of people take outside of pregnancy. If you do have a health condition and you are taking medication, as soon as you find out that you're pregnant, I would either go online on the internet and I would look up the categories of the medication. If it's category D, I would definitely discontinue it. If you have any questions, I would just call the OBGYN provider that you are preparing to schedule with, and I would just ask, hey, can you just ask the OBGYN doctor, do I need to continue this medication or discontinue it until my first visit? And they should be able to give you an educated answer. So one of the most common ones that I see are people who have seizures, and so they'll be on seizure medications, and unfortunately these are known as teratogens. It can cause limb and facial abnormalities inside of the baby. It can cause spina bifida. It can also cause hypoplastic nail beds, which just means that the nail beds will be very small. So yeah, I definitely hear about seizure medications all the time. I hear about blood pressure medications all of the time. Once again, not all blood pressure medications are bad in pregnancy. So like I said, you want to do your research, call your physician if you're on any whenever you find out that you're pregnant, and make sure that it's okay that you're taking them. But mainly blood pressure medications have been found to cause craniofacial abnormalities in the baby. Another one I get is when ladies have had DVTs, which is a deep venous thrombosis, or any type of blood clot or pulmonary embolism previously in the past, and they may be taking something called warfarin, which is a blood thinning medication. You can't take that in pregnancy. That is a teratogen. It causes facial dysmorphism and cartilage and skeletal abnormalities in the baby, so you definitely can't take that. Some antibiotics you can't take in pregnancy, specifically tetracyclines, minocycline, doxycycline, anything with cycline on the end of it, that's a tetracycline, and you can't take that in pregnancy. The main problem with that is it can cause discoloration in the baby's teeth. It can make them very gray, and that won't dissipate. It won't go away. And another one is if patients are taking benzodiazepine. So that includes things like Xanax, which is alprazolam, clonazepam, which is Klonopin. Medications like that can actually cause craniofacial abnormalities and cleft palate abnormalities in the baby, so you can't take those either. So that's all the information I have for you. So happy National Alcohol and Other Drug-Related Birth Defects Week. That is a long name, y'all. But anyways, yeah, let me know if you enjoyed this video. Leave any questions or comments that you may have down below. I just kind of wanted to do a quick video, kind of give you guys some information that I don't think is really talked about. So yeah, let me know if you guys have anything that you want me to answer or anything like that, and I'll answer it for you. All right, I'm gonna get out of here because I got stuff to do. Anyways, I love you guys. Bye.